Welcome to Maryland Medicine Frontline News. Coming up, a School of Medicine sports medicine physician travels to Florida to help WNBA players remain healthy through a COVID-shortened season. But first, an update on the University of Maryland's Incident Command System, which continues to coordinate our response to the pandemic as we enter a challenging time.
The Unified Command is an effort to try and coordinate across multiple different areas of the hospital, the healthcare system, and the School of Medicine. And what we did was we formed a very cohesive team and stepped outside of typical routing of policies and procedures to very quickly identify what the challenges might be for our hospital and school and address them in a very expeditious way.
With fall upon us and the flu season getting underway, there's concern that cases might surge. How is the Unified Command System preparing for that?
The Unified Command was very involved with testing at the onset. We realized that every hospital needs the ability to test appropriately and test quickly so that we understand how much of the patients who are presenting to our hospitals may have SARS-CoV-2. The second area is personal protective equipment, and the Unified Command embarked on an effort to actually build a warehouse within the system to assure that our hospitals across the University of Maryland medical system all have enough PPE in case we have additional shortages. And lastly, the third pillar is around surge planning. And that means that as we have more patients coming through the front door of our hospitals, we have enough capacity to be able to handle that surge of patients coming through the door. Our nation and our state and our hospital systems had to figure out how best to address potentials for personal protective shortages. So what we did inside the Unified Command is we actually leased a warehouse, and we continued purchasing through the spring and summer to assure that we have a robust supply of PPE as we move into the fall and winter, where there may be additional need for PPE and additional patients, so to best protect our providers so they can care for patients. It is the expectation of all of us that we are embarking on an area of healthcare delivery in the fall and winter that will have challenges. And we are making sure that we're not only to address the ability to care for patients who are suffering from COVID-19, but also for individuals who have other challenges that are routine health related and not necessarily linked to SARS-CoV-2.
Third straight possession with a block. Taurasi connects!
The WNBA just wrapped up a COVID-shortened season in Bradenton, Florida. All of the players lived and played in a single facility known as the Bubble to protect them from infection. And a School of Medicine sports medicine physician was there, along with two fellows, to keep them healthy and treat their injuries.
You encounter everything that you would expect to encounter. So, these are high-level athletes. They play hard. This was a shortened season. Every game mattered. So, so as you would imagine, you have, kind of the typical basketball injury, ankle sprains, knee injuries.
Dr. Cothran and the fellows set up an on-site practice to work with players on a daily basis. They also treated family members and the WNBA staff.
That ranges from young children to older adults. So I think with our primary care background, it allows us to provide the best care for all of those individuals.
4 defenders around her.
With 3 games a night, the schedule was grueling for the athletes.
So they were pretty beat up, pretty tired, and had a lot of injuries going on at that point. And the players themselves, they are really warriors. Their normal schedule, they don't really have any time off. So they have a lot of chronic pains that they play through that were really flaring up when they were playing every other day in the bubble.
Sports medicine fellow Ryan Tracy was courtside with Dr. Cothran when an NBA player dislocated her shoulder.
She was boxing out one of the opponent players, and as she was pushing up against the other player, she had some previous injuries before, so she actually pushed up against the player, and her arm kind of went the wrong way, which resulted in her shoulder dislocating while on the court. And she was actually in a ton of pain, and it's a little weird being in the bubble when you don't have a lot of fans around, because there was a lot of screaming as we were trying to put the shoulder back in. And fortunately, everything worked out well. We got her to the ER. It was back in place. She actually was able to play 2 days later.
Sports medicine fellowships at the School of Medicine are among the best in the country.
I was doing all of the exams on the WNBA players, using the ultrasound down there, doing some of the procedures. So, I mean, you're not just tagging along. I mean, you're getting hands-on experience with the highest caliber athletes in unique situations.
During the finals, a bunch of them came up to us, came up to me, came up to Dr. Cothran, and some of the other nurses that were working with us, and they personally addressed us and thanked us for all that we did. So to have a professional sports opportunity like working in the WNBA, that was something that was truly mind-blowing and an amazing experience all at the same time.
It was world-class care for world-class athletes. And that's Frontline News. I'm Larry Roberts. I hope you'll join us again next week.